We're having a couple technical difficulties with sharing our screen. So give us 1 second.
I got almost
Yeah,
5:59.
Yeah, let me know.
The spring is the hardest time, fall too, for that matter.
And it seems like it's coldest on Wednesdays, because I gotta be outdoors.
Yeah.
Wednesday's cold.
If it's gonna rain, snow, whatever, so we'll do it on the day that you have to be outdoors or you're. On Saturday, I got the pleasure of.
Brittany, I got 6 p.m. Mary, can you hear us?
You're on mute.
Mary's on, you're on mute, Mary. Unmute.
Okay, all right, all right.
Mark. Okay, Mark, can you hear us?
Yep, good.
Okay. I'm going to call the Richland County Pine Valley Subcommittee meeting to order Monday, February 16th at 6 p.m. We need a roll call, please.
Cooey,
Here,
Kramer,
Here.
Hendrick.
Here.
Manning. Ripchen,
Here.
Thompson,
Here.
McCorm.
Next on the agenda is the approval of the agenda and verification of posting.
Yep, it was posted in, correct time.
Okay, great. And we need approval of the agenda. Anybody want to make that motion?
I'll make that motion.
Okay, I need a second. Okay. All in favor, please say aye.
Okay.
Agenda is approved. The next one is approval of minutes of the December 15th, 2025 meeting. Everybody had a chance to look at those?
I'll make a motion.
I'll second it.
Okay, all in favor, please say aye.
All right,
All right.
All right, number 5, public comment. Anybody have anything online or here to comment on other than what we got posted? Yes.
And I don't know if this is the appropriate time to say it or when I should say it, but I'm questioning this committee, and the other committee you chair, Health and
Mhm.
Community Services. When something's brought up there and we haven't had it here first, I feel like it's duplication. Like, are we gonna always hear something here and then it goes to the other committee for approval? Because what happened, at the
Right.
last meeting.
We are a subcommittee. We have no authority to change or correct anything. If that happens, it needs to go to Health and Human Services. And sometimes, depending upon the subject, it goes straight to Finance and Exempt. Yeah, okay, because if something is brought up here, then, we can decide if we want it to go up to Health and Human Services. But Health and Human Services overlooks this committee as well.
Right. But I just thought with that issue that came up that was new to me, where we were gonna possibly approve paying an hourly wage on top of a salary. I just thought that should have been something this committee knew about prior to it going to that committee, because everybody in this meeting right now probably doesn't review what's going to Health and Community Services. I know I would, I didn't.
Well, that,
Before I got
that
on
was
that
brought
committee.
up, that was brought up some time ago about that salary. And, we had discussed it some time ago. I don't think you were even on this yet, Emily.
No.
So I think that's where it was probably missed. But then it came back up and then it went straight to finance because they're the ones that deal with the money. We don't.
So did like Mark and Mary know of that?
I knew of it, so I don't know. I can't speak for Mark or Mary.
Well, I didn't until I just heard it at HHS.
Okay.
What'd you say?
She heard it at HHS.
Okay, we went over it.
And was that the first you knew it was being suggested?
Yes,
Yeah. See, I just feel like if I'm on this committee, I want to know what's going on here, if it's going to go further for approval. I just felt it should have been brought up in this committee.
And I think it was, but long ago.
Long time.
And then finally HHS got a hold of it. And it went on up.
Because then when it's going to be reviewed again, will we do that at Pine Valley Committee level? Or is that going to just be discussed at?
Well, that'll be, in the administrator's report. If things are gonna change salary wise or pay wise or hours. Yeah, we will be made aware of it or anybody else is, or at the same time.
Yeah, because I'm just questioning it because stuff gets missed and duplicated.
Yep,
Yep.
it does.
All right, thanks.
The other public comment is, I'm gonna start scheduling donkey visits. Probably about April or May. We will start after Memorial Day, so. And, the first place that I'm going to try to go first, because we missed them completely last year, was, our house. Yeah, we couldn't get there. One was because of weather. So stinking hot and, we don't travel with the donkeys when it's hot and the residents do not need to be out in that type of weather. So, yeah. And the other reason was the military funeral. So we had to cancel on them twice. So we tried to get to them first this year. And everybody's welcome to come. We have a lot of fun, don't we, Elaine?
Mhm.
Yep.
I do.
So you're talking actual donkeys.
Oh, yes.
Donkey visits, I'm like, okay, terminology I'm not aware of.
Oh, no.
I'm listening to this, and when you say the donkeys, I'm like, you're talking actual donkeys.
I'm talking actual donkeys. Yep, yep. We go to, yes, we go to our house, we go to Pine Valley, we go to Schmidt Woodland Hills,
Okay,
we go to Harvest Guest Home,
okay.
and we also go to Sauk County,
Oh, okay.
Sauk County's home. Yeah.
Yeah.
Yep.
Okay.
When we got to Sauk County's home, we did that, what, 2 years, 2 years ago? Nobody with animals has ever come to visit them.
Wow.
We were the first. And there were quite a few people out there, but it's getting to a point now where they're waiting on us to get there. And they're lined up on the sidewalk and
Oh, wow.
you wouldn't believe it. And that's everywhere now. So it's good. It gives them a break, something
Yep.
different. And, you got a lot of farmers and farmers' wives that are in the homes. So to see a farm animal, you know, a dog and a cat is great, don't get me wrong, I've got plenty. But, to see a farm animal, something different. I have a neighbor, she wants to, you know, we were supposed to get together with the donkeys. In fact, she's the one I got the donkey from before she gave birth to Nestor. She's got baby goats. And so we were gonna get together and bring the goats too, but, her schedule is just out of the world. So we didn't get to do that. So I will be calling you to let you know when we'll do that, and then I'll let my donkey crew know and, see if it all works out. Okay, anybody else have anything to say? On to number 6, administrator census.
So January, beginning of, we were at 65, we ended with 68. And we had a high of 71, a low of 64 due to some hospital, stays. Census for CBRF remained at the same at 16 and full.
And how, I'm sorry, Brittany, how many can you have?
80
80.
on the field prep.
Anybody have any questions? Moving along, Pine Valley Financials, year-end financials presented by Leanna. All right.
See if I can share my screen here. Oh, she's got it up already. Perfect. All right, so it's kind of tiny there. Let me make it a little bigger. Okay, maybe it's easier if I do it this way. Steal it from you. Oops, dark. Did something pop up on your screen over there?
Brittany, anything pop up over there?
So I thought it'd be easier if I could share it out of my version, because I can zoom in and make it a little bit bigger.
I can zoom in too.
Okay. Well, so we'll work from this. Depending how big we can make it. So the first one that you see here is kind of going through it by grouping. So we finished the year with revenue at just under 12 million, and that's just sheer revenue. There's no tax levy or anything included in that line there. The tax levy actually goes onto the balance sheet under contributed capital. It doesn't hit the revenue lines, but does impact the cash when we talk about the cash. So revenue just under 12 million for 2025. And then expenses were, sum that up very well. We're at just under 11 million at 10.7 million for all of our expenses, leaving us with just about 1.2 million in, I guess you would say surplus, for the year. So that will go to our fund as a positive impact. We are in the middle of an audit, as you all are probably aware. So these are the pre-audited numbers, which means they are subject to change. I'm not expecting a lot of change in the revenue line. Where I would expect to see some changes would be things they would reclass or anything that they find that would be missing from operating expenses. I did go through cash quite in depth through the cash account, making sure that everything in there was accounted for in Tyler and was able to tie out, I'd say 95% of it, with an overall difference between cash in Tyler and cash in Matrix of about $11,000. So that was the difference overall. And when I talk about cash in terms of what we had at the end of the year for Pine Valley, we ended December with 3.3 million in operating cash. We also have another million that sits in a different cash account that's not touched. It's basically reserved for capital improvements. And another 725,000 that also sits in a cash account for debt service, just kind of as a placeholder of our cash to make sure that we've always got the debt service covered and we've got enough for 2 months of operation should something happen. So overall balance sheet sitting at about $5 million in total cash, not just operating. I didn't share that in here because right now I did find some issues with the Tyler balance sheet in which we had principal payments going against the expenses for the year. And that goes back to the previous county clerk who was in charge and how we accounted for things in the AS 400. We didn't exactly follow what the auditors may have said in terms of not recording it to expenses, but recording it to the balance sheet instead. So when you have a long-term debt or bonds payable and you make a payment on it, it is a reduction of principal on your balance sheet. And the only thing that hits expense would be the interest expense. So there's some of that cleanup going on, and I didn't want to muddy the waters by sharing any of that information from Tyler without it matching directly what I'm reporting to you from Matrix. So what you see in your financials today is what is in Matrix, and that is currently being audited. So the first one here basically just groups it by category for you. So you can kind of see where the revenues came from, what we were spending in wages, what we're spending in fringe benefits, and then payables is just kind of one big bundle there. If you go down a couple pages, or maybe just scroll down, right? Is that the one? Yeah, that's the really busy one. Okay, so this one, anything where you see the R's, obviously in this last column over here indicates revenue, but these are all the various revenues that came into Pine Valley throughout 2025 by month. And if we scroll down a little bit more, we'll get to our X's, which are our operating expenses. So here, when I had promised the last time I gave you bills no line detail, which was basically in Tyler, all of this goes into one line basically for operating expenses other than payroll. But within Matrix, we get the breakout a little bit more of what it actually is, the medical supplies, the taxes, every kind of more detailed for you. So that's what I've provided today, is the detail of where Matrix stands as of December 31st, and these are the numbers that are currently being audited. So I know it's not a lot for today, but I did want to really kind of give you where we ended with revenue, where we're sitting in terms of having a surplus for the year of 2025, all pre-audited. So then once the audit comes in, we'll talk through what those entries are, how they change or impact the financials from what I report today to what I'll report to you, I would say in like a month or two when we get the audit results, because we'll have to put all that in as well. But for now, I just wanted to get something in front of you so you're aware of, what we had for revenue and what we had for a surplus at the bottom, just knowing that it may change a little bit, particularly in those operating expenses.
I thought that audit was supposed to start tomorrow. She show up today?
So they started on computers. I'm reaching out through email, asking to get certain things ready, but yes, she will be out tomorrow, potentially. She will be out on Wednesday as well. And then she worked from home on Thursday, so they will be here getting a bunch of information between Leanna, Haley, and Kayla.
Because she did ask me to attend, so she wanted me to answer her on the email what questions she had. It's like, no, I'll just come up and see you. Go out there and see you. I'm not gonna answer it on email. So tomorrow at 9.
Correct.
We figure.
Yeah, so just briefly, That's really all I wanted to cover tonight, but I will bring you a more in-depth one with a lot more to it when we get through the audit and it all ties out and I can present the beautiful balance sheet to you as well as, you know, the year end. Here's the fund balance moving forward, which I would expect to add that $1 million to our fund balance that we had rolling forward last year, putting us in a pretty good overall financial position for Pine Valley. So. Any questions? I know you might have more after you start looking through the details. If you do, please, by all means, feel free to reach out to myself and I'll try to find you any answers that you have on any of the details if you should need them. So,
Oh, thank you.
welcome.
Anyone have any questions?
Yes, was this the financial director speaking?
Yes.
Okay, thank you.
Yep, you're welcome.
Moving on to the administrator's report.
Okay. Kind of went over the census. So we did have a complaint survey. They came in, they had it, the quality of care is what they were looking into. There was no concern with quality of care. We were missing one narcotic sheet. We got a very small site of that. 1 month we were missing, unfortunately, but everything else was accounted for. We are in our plan of correction and we have been compliant. We are already put back to compliance and we got the SOD, so we're good there. It was called S755. It was pharmacy service procedures, pharmacy record. And like I said, now we are compliant. So we meet coffee every month. As of right now, we are working on root cause analysis for falls, just making sure that nurses understand, you know, battle marks are not a root cause of why they fell. If it's not working, you have to kind of dig a little bit further. So we've been working with educating and handing out. Each med cart now has a questionnaire, like why, basically getting to why this person fell. So that is something that we worked on for this coffee project and the performance improvement plan. Luckily, all of our performance improvement plans are showing progression and we are seeing our root cause be more positive and more in line with kind of like what state surveyors look at, and the staff are becoming more educated on that. So we're really excited about that. Staffing, all the RAs that we sent to school have passed their courses and they are currently training on the floor until they test. So they have about 120 days that they can work on the floor without testing, but if they test in between, obviously that makes or breaks. So if they fail, then we do a lot of education, they can work the floor and then get rescheduled for testing. But as of right now, they're all currently scheduled. We are attending 2 job fairs. The first one is going to be at Riverdale, and that is April 15th in the high school to meet with the kids, maybe help them kind of start their career track if that's something they want to do. And then we actually signed up for the Southwest Tech job fair in Fenimore, where they have specific, you know, nursing and CNA areas. So we are signed up for that. And that one is, what day? It's March. I don't remember. March 25th. So the plan is to go to that. But on census. Preventative, we are doing QA rounds. Each one of our managers is responsible for going around the building and just kind of checking on QA rounds, just fresh eyes in certain areas so we can capture anything. We did find our spot top on the 4-500 plane, the door quit working and no longer make it.
Oh, great.
So we have to replace the whole top. Dining and nutrition, we are in the thick of implementing ITSE, which is the diet orders and how we kind of classify our diets. We had education done today with therapy for our CNAs. Dietary has been on a consistent education with dietary manager and speech. And then just changing, like I said, the ITSE verbiage was already changed over. So we're working on that.
I think I heard or read somewhere that the residents weren't really happy when we first changed over, but that's improving.
Yeah, so I think with any time we switch over to, and we've had some changeover, that too really takes a toll, on how quality things happen, but yes, it has improved. We've also taken away, so like towards the end of our previous place, the residents were very unhappy with it.
Hmm.
And we kind of changed things to make everything homemade. So that's kind of improving. We hired a gentleman who used to work for a school that would feed about 150 children, daycare wise, in Milwaukee, and he is here now, so I think he does a fantastic job. The residents have already enjoyed a lot of, like, his desserts and things like that, so really hopeful, and our other new gentleman, but we can change takes time. We transitioned over in December, at the start of the slow process, but the changing of the menus, you know, we have to determine what residents like, what they don't like. If they don't like something, we take it off the menu. We add things to the always available menu for them to keep, you know, try to keep that satisfaction. I mean, ultimately, we just have to, you know, take it as grievances and figure out how to fix it. And that's what we can do, but the grievances are getting slower and slower coming in, so
Well, good.
that's what, you know, matters, and we want to obviously make them happy, because food is extremely important for the health of our residents, so.
Mhm.
Technology wise, like I said, we're looking at the PCC, we are, like I said, we have been struggling to get paperless, we do all of our incident reports on paper. There's just a lot of things that our current system just very much lacks when it comes to like state and federal regulations, maintaining those. So we're finding ourselves doing a lot of things on paper to satisfy those regulations. PCC is Plan Care, it's the system that is mainly used in healthcare, like skilled nursing facilities, assisted living. It's just, they're more current with regulations, they stay up to date, and they make things more appropriate to get that paperless. And that's the goal with the EMR, is to not have paper. Now we have to keep them for 7 years, and
Mhm.
so it kind of takes up a lot. We did have resident council, like I said, the residents are getting happier, we're seeing less and less complaints. We're doing a lot of training with staff. Kathy, she was a cook prior to going on an FMLA leave. She came back, she's doing a lot of, like, a retraining program with the staff in the dietary department, and see a huge difference. Because compliance rounds are being done, she's out there side by side with them, just, you know, helping, answering questions. So we're very, very excited for the future in general.
What's this about walkie-talkies?
Oh, yeah, implement walkie-talkie.
Thank you.
So that was the other thing that we're looking into too, when it comes to our technology, and I didn't put on here for some reason, is our call light system. So there is a huge delay, not so much as like call lights in general, like if it's staff emergency, if staff are in the in a resident room taking care of them, and there's a call light going off, and it's going off because within 5 minutes they should be answering them. But, you know, obviously if we get hung up in rooms, we've got, you know, on the 300 wing, we have acuity there. So it's just added communication, like, hey, can you come down? Can somebody come down to the 300 or whatever? So it's been very positive. People use it like they're supposed to, especially emergency purposes. Can I get a nurse in X, Y, to Z group stat? You know, housekeeping. You know, it's that communication piece where people don't have to carry their cell phones to try to have that communication. Just super beneficial, and I've seen great outcomes so far. And I'm excited to see kind of how that continues on to get better resident care.
And I saw the walkie-talkies.
Yeah.
Okay.
So super excited about them. And yeah, so I did get us signed up also for the Richland Center Community Senior Center. Life's a Beach this year, so we're gonna set up a booth, meet with residents. And these things came in after I had submitted the packets. I'll get these also submitted, but so far, our wound care when switching over, I mentioned back in December, we were switching over to wound care. For the month of December, we saved $1,700 on care, $1,700 for 1 month. I also requested that we did not do it was CMS for our fine that we had them under a $14,000 fine.
Mhm.
I said we were not going to do a financial hardship. So they dropped it by $40,000. So instead of paying 114, we dropped it down to 74,000. So we paid 35% off. Super happy about that. So yes, that's where I'm at with that.
Any questions for Brittany?
I have a couple of walkie-talkie things. So before the walkie-talkies, you guys use cell phones? You guys use?
No, so like each department, so like maintenance, we have to call maintenance, say, hey, are we have to track them down? And then been in the building, to be tracking people down. So just kind of give like housekeepers with their supervisor immediate contact without having to track people down or all. As for CNAs and stuff that they have to track down their nurse.
Yeah.
Things like that.
So the walkie-talkie is a good thing. I was just thinking.
Yes.
Just knowing how some young people are with their phones.
Yes.
Running around with their cell phone, and that's how they need to contact stuff. They're gonna be spending more time on the phone than they're doing what they should be doing. So I like the implementing of walkie-talkies, get rid of the cell phones. You know, if that's how they were communicating, like get walkie-talkies, they can't be scrolling through walkie-talkies. Not saying that all of them do, but it does have a little bit of a reputation there. And then how, when you were talking about staffing, how is staffing out there?
I mean, Stephanie's gotten a lot better. I will say that. We do have a lot of call-ins that have occurred. And even like this last weekend, 5 call-ins. We have a GI bug going now too. So that doesn't help, but I mean, we are dwindling down the amount of agency that we are using, especially with like our CNA usage. We do have some contracted that we did like week contracts with versus like 4-week contracts, so we can, lessen the board where they're signing up for one shift and outdoor or whatever. So we're trying to keep that continuity with the use grid treat. But we're dwindling those down. A lot of our nurses, some of our PRN nurses we were able to kind of talk to and, get them to take position. So we kind of got that, hired a full-time RN. So it's just tiny little bits and pieces here that we filled. We have one at MLA, so we were covering those, we'll break bones and or have AEs. So, just covering those in that short period of time, but it is improving significantly.
So is COVID still going around out there?
No break for COVID. That was me this last time. I was the problem. The rest of the stuff is not me.
Okay,
The rest of the outbreak is not me.
so I should wear a mask.
I would wear a mask. Yep, we're in outbreak, so recommended for visitors when they arrive to put a mask on. Wash your hands.
Get one at the door. Yeah, because my masks aren't the ones like you get up at the hospital when you go, so.
Correct. Pat will be there, so
Okay,
she'll be able
Oh.
to direct you. The V9P over there makes us wear masks.
good for you. Okay.
And Jeffy, is there anything you want to add to anything that I said?
I think, yeah, like you said, agency is really dwindling down, especially with the new CNAs that we're getting in. We're not re-signing a lot of those contracts that we had because of adding these new CNAs. It just can, nurses still continue to be a struggle, but
They're getting
that's nationwide though.
Mhm.
On the plus side, though, a lot of our agents, people have noticed how great it is to
Yes.
work there, the caseloads from across other places where they've worked. there's not as much, so like you go to any other facility, you're looking at like 12 patients per person, and that's just kind of your national average. And so they come here, it's a little bit less, and they love working there, and we've brought on quite a few agencies that have been phenomenal.
And they transitioned to our staff because they enjoy our building so much. We've had quite a few on. Yeah.
Exactly.
Yeah, yeah, they wanted to stay.
So how many patients per nurse or whatever?
So CNAs, it's either between 1 to 8, 1 to 9, which is ideal. They were at 1 to 7. But I think 1 to 8, 1 to 9 is more appropriate budgetary wise. But the residents still get care.
Nurses are like one nurse now.
Maximum 20.
Oh, she's-
And right now, none of our halls are completely full, so it's 1 to 8. 1 to 17, depending on.
So I had a couple questions. So right now, because we are a nurses choice kind of, the supervisors are just, they don't do like an every third weekend. They don't do weekends at all. I was just curious how they.
They're all on call. So
They don't have schedule.
they don't have schedule. They're Monday through Friday. They cover the med techs and the LPN that, you know, the RNs need to do on that position. But every weekend, each one of the nurse managers is on call. If there's call-ins for nurses, they're required to come in.
Because I know the hospital, I had to go, like my friend now, she has to work every third weekend. They just can't fill either. Then the other question I had is with the sites. Now, did we only get one IJ that we had to pay?
Yeah, so the CPR, the other one we did get was that CPR, where that nurse did not perform CPR, but we went into a meeting process on compliance. So I haven't heard anything about a fine potentially for that one, because it's not like the one that we got for the change of conditions where it was days and days, and days. This one was self-reported, did everything correctly. By the time they came in, which was that following Monday after all that occurred, we were already done. So we had everything ready and everything done right before. So I don't know if we will get anything for that. They've never mentioned that we would get a fine for that, because I think maybe 2 days went by that we would have gotten that immediate check rate because we did everything right.
But again, it's really not fair when it's agency staff.
It was our own staff.
Oh, with the CPRs? I didn't realize that.
So we had a staff member, back in June, this June. We had come in from the weekend. Granted, this resident, was not at the top of, you know, their game or the healthiest person and was declining. But the resident wanted to remain a full co. That was their decision. Family was on board with it. The nurse that was involved on the night that our resident passed away, had gone to Jesse and not agreed with her code status
2 weeks before.
2 weeks before. And so Jesse had educated this nurse that does not matter what we feel, you know, we do all the education, and that is our requirement. And as long as they know what will happen in the event of us completing CPR and they want to choose to remain, we have to abide by that. It's their decision. Well, on the night of question, did not want to perform CPR, called the physician, completely bypassed it, and tried to not have to perform, and she did. The CNAs and the nurses, the LPN that happened to be on there did not agree, but she was the RN in charge of the change of condition that we had, and, you know, we pounded it into them, like, the RN was the go-to person. So they were like, okay, well, the RN says no. So we had to do a lot of education. We self-reported it, said that, you know, we've not followed care plan. This resident ended up obviously with harm because they died instead of what we were supposed to be doing. We did everything that we were supposed to do. We self-reported it. I did a bunch of mock drills between Jesse, myself, the nurse managers. We came in on all hours of the night to, you know, get all of our CNAs, all of our nurses to be signed off that we completed mock drills. They understand that they bypass nurse when it comes to this. So we did a lot of work and checked our carts, we went through everybody's code statuses, we did everything. We did in-services, we pretty much drilled it in their head that when it comes to CPR, it does not matter what license you are, that if they're in full code, we have to start. So, they came in because we tattle on ourselves anytime we don't follow care plans, anytime something could potentially, and it could potentially cause harm. We tattle on ourselves, so I don't know if it was from our self-report or if somebody had reached out to the state and made that comment. So they were they were out the same day, said that we did a beautiful job and that they were gonna use our, work that we did to get ourselves into a pass on compliance to other buildings. Because we're not the only building, but they were very happy with what we did. I got a call the next day that I come right into a pass on compliance and submit plan of correction for it.
The comment from the state was, this isn't a success, but you guys are a success story because of what you did. So.
And this perked my ear up because I teach CPR and I certify people with CPR, so you're like, shit, I'm like, what?
As a
Yeah.
result, it was reported to the Wisconsin licensing board.
Good.
Yep, and that nurse immediately was out the door.
Okay. Yeah, because I like that, yeah.
We did the due diligence, we did the investigation, and I knew what I needed to be done the day that it happened, but I have to give fair,
You suspended him.
suspension, pending investigation, like we do with everybody else, and, look into it and find, do a lot of interview, asking questions to find out what their intent, and obviously intending not to perform CPR shows that intent.
Reference back to the conversation I had with her on the phone with her when we were suspension. So,
Yeah.
And we educated the doctors, explained to them that
because they didn't know.
they didn't know that, when somebody is a full code, we have to do everything in our power here regardless of it. Is she cold? Is she?
Yeah, it was it was a perfect storm because the nurse knew if she called the doctor and said, this person's cold, the doctor's gonna say, well, then it's fruitless, don't do it. Not knowing that in our long term, we do it, doesn't matter. So the doctor was education. EMS came out and helped us do some of the codes, so then they got a little experience with them as well, so.
Any other questions for Brittany?
I'm missing some of this conversation, but is this that they were just talking about something new, or was that back in when we got that citation?
Back when we got that citation.
Okay, thank you.
Yep, just filling Ms. Thompson in on it.
Yeah.
Pardon me?
I said we were just filling in Tiffany on it. He was,
Okay,
yep.
okay, all right, thank you.
Anytime you can't hear something, just speak up. Okay, Mary? Mark?
Well, I thought I was catching it, but I was kind of lost.
Moving on to future agenda items. Anyone have anything in particular they would like to see on the agenda for next month? Anybody online?
No, I'm good.
Okay.
Yeah, I am too.
All right. All right, number 10, we need a motion to adjourn. Okay, Pat, Tiffany. All in favor, please say aye.
All right.
Aye.
All opposed, you may stay. So, everybody be safe, and we'll see you soon.